Once we make the diagnosis of ATTR-CM and we've started treatment and now we're following them for longitudinal care and monitoring, there's several things that we can use to potentially see how the patients are doing and guide our overall care of the patient. One of the most helpful things is just ask the patient how they're doing, and they can tell you how they're feeling, what they're able to do at home, what sorts of exercises, activities they can do, and we get a lot from that. There are some more formal evaluations. The Kansas City Cardiomyopathy Questionnaire can encapsulate that even a little bit better, but we don't use that a lot clinically because there's some time involved in other things. Biomarkers can certainly help. NT-Pro especially can show over time whether someone's holding on to more fluid or if their heart's not working as well. Occasional echocardiograms can help decide if the patient's heart function is remaining preserved or if it's starting to decline. And those can all be combined together. We most worry about patients that clearly are not able to do as much as they used to be able to do. They may develop autonomic dysfunction where they're having more lightheadedness when they stand up or drops in their blood pressure. Their NT-proBNP may be trending up. All these things may be going in the wrong direction.
Indication and important safety information. Indication. Attruby, acoramidis, is indicated for the treatment of cardiomyopathy, of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults, to reduce cardiovascular death and cardiovascular-related hospitalization. Important safety information. Adverse reactions. Diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.